if you're not sleeping properly or adequately, you have an increased risk for dementia and for Alzheimer's disease. Sleep problems precede a formal diagnosis of Alzheimer's for many people by many years. And over 60% of Alzheimer's patients have at least one clinical sleep disorder. And so there's a bi-directional situation that's happening there. And additionally, if you're getting decreased sleep, you have a decreased ability to clear beta amyloid in the brain via the lymphatic system, which is like the brain's lymph system. And the lymphatic system basically opens up, and that drainage, that detox, that movement of toxins out of the brain is much more active at night if you're sleeping.
Yeah, people have heard about it before on this podcast, but your brain has its own detoxification system,
which is active at night much more than during the day. And so if you're skipping out on sleep, you're not getting that flushing of those toxins from your brain.
It's like the example that I've heard functional medicine doctors like yourself say is that at night is kind of when the city's asleep and all the trash collectors go around.
That's so right.
And they're picking up all the trash that's out there.
Yep. The streets are quiet, not a lot of traffic. And yeah, exactly. I like that analogy.
And your brain can do its job. But if you're not sleeping well, and if you're not getting deep sleep, then your brain's detoxification system, which you mentioned is called the lymphatic system, can't do its thing.
Exactly. Yeah. And it goes the other way too. So beta amyloid can accumulate in the medial prefrontal cortex region.
And just as a reminder for people, because sometimes new people are listening to the podcast, what is beta amyloid? Why is it so important when it comes to cognitive decline?
So beta amyloid is one of the key proteins that can accumulate in brain cells and cause damage. And we don't totally know, is the accumulation of the beta amyloid, is that deposition itself the primary factor, or is there some other process that's going on that's causing that deposition? But we do know that this is one of the key findings with folks with Alzheimer's. And again, we do see that, accumulating in the medial prefrontal cortex, which is a very important part of the brain that initiates deep non-REM sleep. And so then you get this sort of worsening cycle as you head down this pathway. You further exacerbate or lose that ability to get that deep sleep, which is so healing and so cleansing.